Hello everyone and welcome to this week's edition of Let's Talk Shop. My name is Debbie DiMartini. I'm a certified clinical thermographer with Thermal Body Scan in Santa Cruz. And today the discussion that we're going to have is about breast surgery. So whether that includes breast augmentation, maybe reconstructive surgery, if you've had mastectomy and you have breast implants put in for reconstruction, whether it's a reduction, a lot of people have breast reduction surgery, lumpectomies, any kind of cosmetic or reconstructive breast surgery is what we're going to be talking about. And the reason that I bring this topic up is what I find in my, almost 6 years of being in practice as a certified clinical thermographer, talking to, I've probably seen over 1,000 women. A lot of women who have had breast augmentation or reconstruction are not doing their annual screening mammogram. And, having kind of talked to people and had a lot of conversations about this, what I'm finding is that a lot of women are afraid that during the routine annual screening mammogram, they're afraid that the compression plates will rupture the breast or cause damage to the breast tissue. Unfortunately, I have actually seen this. I've had patients with ruptured breast implants. I've also seen patients who have broken blood vessels due to injury caused by the compression plates used during their screening mammogram. So one of the things I want to talk about is, obviously as women, we need to try to get the earliest possible detection. And so it's really scary to me as a clinician to hear that people are not going in for their routine screening, annual screenings. People are not doing their breast self-exams every month. So thermography fills a really great gap for anyone who's had any type of breast surgery. There's certainly a number of factors to consider when trying to decide what type of screening modality you want to go with. Certainly there are some complications that can occur if you've had breast surgery of any kind. The composition of your breast tissue has changed. You may have introduced an implant. Certainly there's going to be, with any type of breast surgery, scar tissue that is now in your breast tissue. And the problem with mammography is that it's really, really hard for that type of test to distinguish between an abnormality in your breast tissue or scar tissue. So one of the things I'm going to talk about with thermography, number one, there's no compression. So first of all, it's an excellent screening tool for anyone that's worried that they may have a ruptured breast implant or damage to their breast due to the compression plates. With thermography, there's absolutely nothing that touches you. It is literally a camera sitting here behind me that takes pictures of your body's emitted heat patterns. You're seated with your hands in a position like this and nothing comes near you. So there's no risk of rupturing or damaging the breast or a breast implant. Additionally, because thermography is a different type of test, it is looking for activity in your breast tissue. Now, once scar tissue is healed, certainly depending on the severity of the surgery, there will be different variances of time frame involved depending on if it was a lumpectomy or a full mastectomy, breast reduction surgery. There's going to be different levels of healing and scar tissue involved. But with thermography, once the scar tissue has formed and is stabilized, it should not have any activity associated with it, which gives us the advantage over mammography in that mammography is looking for anatomical change in your breast. So whether that's a lump or something that looks abnormal in your tissue, they can't determine if there's activity going on with that. Because thermography can, we can differentiate between scar tissue, fibrocystic breast disease, or a developing lesion or tumor. Certainly a developing lesion or tumor will have a certain heat signature because we're looking at developing blood supply that's feeding that tumor. An inflammatory response or inflammatory cancer will have a different appearance and heat signature than, say, a lump. Additionally, fibrocystic breast disease will have an inflammatory response, but those things all measure different temperatures and they look very different in their patterns. So we're able to kind of differentiate between the different types of things that may be going on in your breast. That may mean that you can avoid panic, and certainly there may be the avoidance of biopsies because we can determine what it is exactly that's going on in your tissue instead of just saying, oh, it looks like something abnormal in your tissue, which is basically what the mammogram would say. So certainly consider thermography. Any woman that's undergone any kind of breast surgery I urge you, please don't avoid having your testing done. I get it. Nobody wants to have a ruptured breast implant. Nobody wants to have to go through the pain, the risk that's associated with having to replace an implant. And I've seen it happen. It does happen. But certainly with thermography, it is safe. It is painless. There is no radiation. Nothing touches you. So I urge you to check it out. Please definitely visit my website. I've got a whole tab on my website about breast augmentation and reconstructive surgeries and thermography. Visit my website at www.thermalsc.com. Again, my name is Debbie DiMartini, certified clinical thermographer. Thanks so much for joining me, and I'll see you again next week. Thanks, guys.